Hey everyone, welcome back to our channel. Today we're going to give you this year's guide at preventing and treating common eye infections coming up. First off, it's important to wash your hands frequently. This simple action can significantly reduce the risk of spreading and acquiring eye infections. So remember to wash your hands thoroughly with soap and water. And I always tell my patients to dry your hands with a clean lint-free towel before putting on your contact lenses. After a decade of treating eye infections and teaching people about contact lens comfort, I've always said that the #1 enemy to contact lens comfort is using a brand new hand towel before putting on your contacts. Next, avoid touching or rubbing your eyes. This can introduce harmful bacteria or viruses into your eyes, increasing the chance of infection. Our tears contain a certain amount of ingredients like lysosomes that can actually kill a certain amount of bacteria that makes its way from our eyelashes or from a nearby sneeze into our eyes. But if there's too much bacteria or virus, you'll be left with an eye infection. If you just have to touch your eyes, make sure your hands are clean, use a gentle touch, and take this excuse to clean your eyelashes. Maintaining a clean environment is also crucial. Clean your contact lenses properly and as directed by the optical team at your optometrist's office. If you wear makeup, avoid sharing it and make sure it's not expired. And on top of that, regularly clean your eyeglasses or frames to prevent bacteria buildup. On eyeglass frames, bacteria love to build up, especially in the nose pads, on the temple and earpieces, and on the upper half of the frame where the top of the lens can interact with the eyebrows. When it comes to treating common eye infections, there are a few remedies that you can try at home. The disclaimer here is that watching this video doesn't create a doctor-patient relationship, and the treatments discussed should be applied at your own risk. And of course, the best source of knowledge about your eyes will come from your very own local eye care provider. For pink eye, also known as conjunctivitis, you can apply a cold compress to soothe the inflammation. Use sterile eye drops or artificial tears to relieve any discomfort. Now let's talk about styes. These painful bumps on the eyelids can be treated at home by applying a warm compress several times a day. This helps to invite the immune system to the infection, soften the oil plug that's preventing the stye from draining, and promote healing. Avoid popping or squeezing styes at all costs, as this may worsen the infection and push it deeper into the oil gland in the eyelid where the infection is located. And as far as preventing styes, be sure to regularly clean your eyelashes either in front of the sink or in the shower. Now, if you wear contact lenses, it's even more important to practice good hygiene. Clean and disinfect your lenses as directed and never sleep in them unless advised otherwise by your eye care professional. My patients know that I always recommend removing all contact lenses at night, including soft contact lenses that have been approved by the FDA to sleep in at night. And yes, there are certain types of contacts called ortho-K lenses that your optometrist will recommend that you actually sleep in. These are the exception to my rule of never sleeping in contact lenses. And in the morning, when you put your contact lenses on, be sure to dump the multi-purpose disinfecting solution out of the case, rinse your case with hot water, and let your case dry with the caps off the case. Take a second, smash the like button if you're getting any value out of this video. If you like swimming, hot tubbing, or water sports, be sure you're not wearing your contact lenses while participating in that activity. Pool water, lake water, and ocean water all contain microorganisms that can cause severe eye infections that can lead to blindness, and this is why your optometrist always teaches you to not wear your contacts in the water. The microorganisms found in the water can get trapped under your lens, under the contact lens, or embed themselves in the pores of the lens and start eating away at the cornea beneath it. And sometimes the bacteria and microorganisms that come from the water can be difficult for even the most experienced eye care providers to cure and to come up with the most appropriate medication to fix. So best to avoid mixing water and contact lenses. And if you ever feel like you have an eye infection coming on, like redness, irritation, eye pain, severe light sensitivity, and blurred vision, avoid sleeping on it for a couple days and make an appointment to be seen that very day to have your eye care professional take a look. Most eye care clinics who are serious about serving patients with higher standards of care will accept patients with eye infections or eye injuries same day, even if their schedule is completely full for the day. It's best not to wait it out if you have a true eye infection. Remember to regularly visit your eye doctor for routine checkups. And for more information about eye infections and what to do if you have them, you'll definitely want to watch my eye infection playlist by clicking the link on the screen or by finding the link in the description below. Thanks for watching this year's guide to prevent and treat common eye infections. Subscribe to our channel for more helpful content. We'll see you in the next video.